welcome to part 2 of our GrowBaby webinar. My name is Emily Ridbaum, certified nutritionist and lifestyle educator. We are going to pick up where we left off in our first trimester nutrient requirements, but first I want to give you a brief review of our previous webinar. We want to remind all of you that there are many factors involved in a healthy pregnancy. It is how all of these factors interact with one another and the state of mind that we adopt during this wonderful time that truly yields health. We will individualize nutrients to bring focus to their roles and how they interact with one another, but that is not to say that this intense focus means that we are losing sight of what fetal programming is. We have reviewed the basics of fetal programming, what happens in the body composition shift for mom during the first trimester. We've reviewed 3 amino acids, L-carnitine, L-cysteine, and L-methionine. As finally, we reviewed basic protein requirements during pregnancy in the first trimester. Let's get started with amino acids and their roles. L-carnitine helps to regulate blood sugar by decreasing free-floating fatty acids in the bloodstream, which in turn will help decrease the risk of gestational diabetes during pregnancy. It's also involved in energy metabolism and detoxification. L-methionine, a sulfur-based amino acid, is integral in the interaction with B vitamins, specifically B12, B6, folate, and then also choline. And these help to decrease the risk of poor energy, fatigue. We have reviewed the basics of fetal programming, the shift that happens in body composition for mom in the first trimester. We've also reviewed 3 important amino acids, L-carnitine, L-methionine, and L-cysteine. And finally, we reviewed basic protein requirements during pregnancy. Let's review the amino acids and their roles. L-carnitine helps to regulate blood sugar by decreasing free-floating fatty acids in our bloodstream, which can help reduce the risk of gestational diabetes during pregnancy. It is also involved in energy metabolism and detoxification. L-methionine, a sulfur-based amino acid, helps our bodies utilize crucial B vitamins like vitamin B6, vitamin B9 or folate, vitamin B12, and also choline, which help to decrease the risk of poor energy and fatigue, promote central nervous system development, as well as decrease the risk of high homocysteine levels, an inflammatory marker that we can lower as we meet our vitamin B6, vitamin B12, and folate needs. High homocysteine levels in pregnant moms have been linked to things like pregnancy-induced hypertension or high blood pressure during pregnancy, placental abruption, small and large for gestational age, and neural tube defects. In fact, 20% of women with children that have neural tube defects have abnormal homocysteine levels. L-cysteine is also a sulfur-based amino acid, which helps our body utilize the same crucial water-soluble B vitamins that L-methionine does. It also helps our body make and absorb proteins throughout all of pregnancy. L-cysteine ultimately converts in our body to N-acetylcysteine. N-acetylcysteine is a cofactor in the production of a potent antioxidant called glutathione that helps decrease cellular damage and stress. Higher levels of certain amino acids, like L-cysteine and amniotic fluid in healthy fetuses, has been linked to decreased risks of spina bifida, a common neural tube defect. Moving on to protein requirements. Remember that 0.8 grams per kilogram of your pre-pregnancy weight for a single baby are just your basic needs for pregnancy, in the first trimester, that is. So take your weight in pounds, divide it by 2.2. Once you have that number, divide it again by 0.8, which will get you a gram amount. If you want to see your gram amount in ounces, then go ahead and take your grams and divide that by 7. Now, if you're having twins or triplets, you're going to need more protein. If you're having twins, you're going to increase that by 25 grams daily. If you're having triplets, you'll need to add 50 grams daily on top of what your calculated needs are. Now, I know it seems like a lot of protein, whether you're having 1 or whether you're having 4 babies, but it's about a quarter of a cup of nuts is 7 grams of protein, or half a cup of beans is 7 grams of protein, or half a cup of yogurt, 1 egg, 7 grams of protein. And so really when you add up all your foods that are high in protein, like nuts and seeds, legumes, dairy and dairy alternative, and also animal-based protein sources, then you can reach your daily requirement fairly easily. Just small snacks throughout the day. Okay, moving on to our next big macronutrient, fat. I love fat. I think it's delicious. And there was a great article that recently came out in Time magazine called Ending the War on Fat. And I think it gives a very clairvoyant description of the misunderstanding that our society has with its relationship with fat, and as a result, the health consequences that we have because of that misunderstanding. I want to help clearly distinguish the role of healthy fat during pregnancy because there is a reason that some fats are essential. When we say essential, what do we mean? We mean that our body doesn't make those fats, so we need to intake them, just like there's essential amino acids and non-essential amino acids. The essential fats that I would like to focus on for pregnancy are omega-3 fatty acids. The omega-3 fatty acids, ALA, DPA, and DPA and DHA, a lot of acronyms in there, particularly DHA, is essential for brain growth, eye and nerve development of a growing baby and a developing infant. It is part of every brain cell that your child will have. DHA is the main fat found in your brain. In fact, 60% of the dry weight of all of our brains is DHA. It's pretty incredible, 60%. DHA upholds the integrity of all of our cell membranes as well as all of our mucosal membranes. Studies show that babies whose moms consume more fish have higher IQs, have better sleep patterns. Don't we all want those, Mom? And finally, have greater visual acuity, so some huge benefits are reaped from intaking this essential fat. So how do we intake those foods, and what are the top food sources of omega-3 fatty acids? There are both animal and plant-based sources available, but the most potent and concentrated source that you will find, of DHA at least, is in cold water fish. Top animal-based sources are salmon, wild organic cod, scallops, sardines, tuna, we all love tuna, right? Cod. And then the top plant-based sources are flax seeds, which primarily contain ALA, but our body can convert ALA into EPA and DHA. Chia seeds, walnuts. I love walnuts. Walnuts actually look like a brain, which I kind of love. Cauliflower, cabbage, these cruciferous veggies, broccoli, Brussels sprouts, romaine lettuce, winter squash, tofu. And then finally, certain algaes do contain a certain level of DHA. Other benefits of adequate essential fat intake include longer gestational age. In fact, in one study, moms who took DHA just specifically in the 3rd trimester had a longer gestational age of up to 6 days. Decreased risk of postpartum depression and anxiety, which we will touch back upon in the 3rd and the 4th trimester. Decreased risk of cardiovascular disease. Improved hair, skin, and nail health. Well, mom doesn't want that, right? And finally, decreased risk of allergy and asthma for your little one and for you. So we suggest from the years of research that has been done on the rules and requirements of EPA and DHA in a developing baby and mom that moms intake a minimum of 400 milligrams of EPA and 300 milligrams of DHA for a total of 700 milligrams. Now, more may be needed on an individualized basis. So we do encourage you to check in with your OB practitioner or your midwife to see what your personal needs will be. As always, we do try to encourage food first. So I'll give you an example of how we can meet these omega-3 fatty acid needs beyond a fish oil capsule or a flaxseed oil capsule. Here are just a few of the examples that I would like to highlight that exceed the minimum requirement that we just talked about. So if you're intaking these foods, then you are covered. 4 ounces of salmon, about a little more than the palm of your hand, is about 2.1 grams of EPA and DHA. Scallops, 4 ounces again, 1.1 grams of EPA, DHA. Ground flax seeds, 2 tablespoons is 3.5 grams of EPA, DHA, also ALA and DPA. And walnuts, 1/4 cup, delicious walnuts, 2.3 grams of EPA, DHA, DPA, and ALA. There's lots of acronyms in there. Again, I'm sorry about that. So as to review, Without essential fat, our bodies do not have the support they need to ensure proper central nervous system development, cell membrane health, mucosal membrane health. Without essential fat, without that lovely fat, we can't decrease the risk of asthma and allergies or cardiovascular disease or postpartum depression or depression of any kind, as well as increase how lovely our hair looks and how wonderful our eyes work and how great our nails and how strong our nails are. So what do we think about fat now, especially during pregnancy? Without fat, we truly can't optimize a healthy pregnancy, and it is an integral part of the macronutrient composition that makes this up. We will pick up at our next macronutrient, carbohydrates. We will discuss what type of carbohydrates are health promoting, what the role of fiber and probiotics have during pregnancy, and then continue into the micronutrients, my favorite micronutrients, B vitamins, all sorts of B vitamins, but specifically we will focus on B6, B12, and folate. Thank you so much. We always look forward to seeing you. We'll see you in 2 weeks.